Welcome back to another episode of the Real Talk on Women's Health podcast with Essentia Health. I am joined in this episode by Dr. Lauren Jamar, a family medicine provider at the Duluth Family Medicine Clinic at Essentia Health. Thank you for being here.
Thank you for having me.
I always love having another Lauren. So, I mean, this is automatically going to be a good episode, two Laurens. But we are talking about a primary care provider's perspective on your top women's health questions. These are questions that listeners have submitted to us and just really common questions that I feel like a lot of times women are maybe too embarrassed to ask. I feel like it doesn't matter the age. There's things that I'm still embarrassed to ask my doctor. I do, but it's just kind of part of being a woman, I guess. So let's start and talk about younger women and reproductive health. How do you approach discussions about reproductive health with young women, like topics like contraception and family planning and things that might be new to them, I guess?
That's actually one of my absolute favorite things to discuss with patients. And sometimes you get lucky and someone comes in and, they just come in for their physical and they said, oh, well, I really think I'm going to be starting a family. And I got really lucky in my first job out of residency that I had a few of those do that. And then they would show up as my first OB, a few months later. But I look at it as you have a choice and you actually have a lot of control in this. And I think a lot of young women, especially, they don't know that they have a lot of control over, hey, do I want to be pregnant or not? Let's think about, do you want to be protected from pregnancy? Are you ready to be pregnant? There's another really good non-judgmental way to ask it as, in the next year, would you be okay with being pregnant? What would that look like for you? And kind of phrasing it that way with them.
Something that people also talk about lately, I feel like, is going off birth control, or if people were on birth control for a while, now they do want to start that family. Is there anything that people need to know about going off? I feel like I always see horror stories about going off birth control. Are those true, or what should people be aware about?
Well, a lot of it depends. I'd have a lot of follow-up questions for them in terms of why were they on the birth control in the first place. But if they're getting off of it in order to actually start a family or with the intentions of getting pregnant, it's like, all right, we're getting off of birth control. You are able to get pregnant. Some birth controls, you're able to get pregnant as soon as you stop it. Or we have a lot of the devices that are now, they're either intrauterine or they're subcutaneous. They're implanted under the skin. And oftentimes, as soon as those devices are out, someone is able to get pregnant within the next few weeks. So what they need to know is, are they at a point where they're healthy to have pregnancies? And that means, if you are smoking, cutting back on how much tobacco you're using, or if you're using THC, really cutting back on the amount of substances you're using, and then really paying attention to your cycle. That's another really good thing to do. Being on a prenatal vitamin, you don't have to be pregnant to be on a prenatal vitamin. There's actually a lot of really good vitamins and supplements in those that I recommend them for any woman of childbearing age, or even women who have already finished up having their children.
So now I want to talk about maintaining a healthy weight, because my goodness, this is something that I feel like every woman deals with. And for me, it was like, I'm 32 now, but in my 20s, I just ate whatever. I don't think I ate a vegetable in my 20s, and I just did not eat healthy. I didn't really take great care of myself. I was like 4 hours of sleep. That's enough. But then once I hit my 30s, I did notice like I really have to pay attention to absolutely everything that I eat and really focus on taking care of myself. So we talk about metabolism, like what can I do to lose weight and maintain a healthy weight?
Yeah, it's true. I don't necessarily know if there's a lot of scientific evidence to say, oh yes, with each decade, your metabolism slows down. But for sure, I notice it myself. When I was starting out as a young physician in her early 30s, I had a lot of, 40 and 50-year-old women coming into me with these weight issues. And I was like, what are you talking about? Well, now I kind of know what they're talking about now that I am a physician in my 40s. A lot of it is, I think some of it has to do with body image, but what do you do to eat healthy? It's really, it comes down to the basics of, are you eating a balanced diet? You should always have half of your meals be vegetables and fruit, actually. There's a lot of fad diets, like there's the keto diet, which is kind of the common reason why some of these diets do help, is that they don't rely on carbohydrates, as the primary source of calories. And so carbohydrates are very important. They're very important energy. They're actually, there are very healthy carbohydrates, so if someone is an endurance athlete, for sure they need a lot of those carbohydrates. But I think we have a tendency, because they're easy, to fall into that, let's have noodles again tonight, or let's eat some rice. And so kind of limiting that. And then the other thing is your activity. And it doesn't have to be, going out and running 5 miles every day, but just finding ways to be more active, taking the stairs. If your place of employment has elevators, try and find the stairwells. Dogs are great for activity, getting a dog and making sure that you get out on walks. Unfortunately, as you get older, increasing your activity level alone probably does not help you lose weight. So you do also have to just watch what you eat and like limiting anything processed, anything that comes out of a box, anything with refined and processed sugar, all those lovely Oreos from the grocery store, really hard to avoid, but that's important. If you're able to cut out some of that.
They're so good though.
They are so good. I know. Yeah, we actually have a big sweet tooth in our family. All of us have sweet tooths, and it's very challenging. And
it's all about balance too. You don't want to like deprive yourself, but probably have 1 or 2 Oreos rather than have the whole sleeve I did in my 20s. When should somebody be concerned when they're not losing weight and they're trying? Like, does that mean that something's wrong? Because I always am like Googling, like, why am I not losing weight? I'm working out so much. And I know there's a lot to it, but when should somebody be concerned?
Oh, for sure. Yeah. There's definitely conditions like especially your thyroid. Hypothyroidism is a common one that can make it really harder to lose weight, or people just notice they're putting on a lot more weight. If you have not changed any of your eating habits and you are continuing to gain weight, then I would for sure seek out help of a medical provider to look into like what is going on, because there are some conditions that can lead to that. The other thing is sometimes people fall into they're actually not eating enough. And so their bodies are kind of in a starvation mode. And so then the metabolism slows way down. And so we actually have seen that a lot with some women. They're being told, oh no, you have a condition where you have to lose weight. And so then they restrict themselves to these, 1,000 calorie diets or lower. And that really isn't sustainable for them. And when they meet with a nutrition or a dietitian, then they actually find out, oh, I'm actually not taking in enough calories. So I think if you have restricted your eating and you aren't noticing any changes, then it really is time to look at that and say, maybe I actually took this too far. I need to approach it from a different way. For sure, like if you don't see the effects that you're expecting. And then anytime eating gets disordered, so you are obsessing about it, you are really restricting calories, not going out on social events with friends because it entails food. If you are kind of starting to get into that, then you really ought to seek help.
And I think another thing too is like consistency, because I see so many people, they'll do like this crazy diet for 2 weeks and then they're like, why am I not losing weight? But you got to be consistent with it as well.
Yeah. It takes 90 days to make something a habit. And so that's kind of a good rule of thumb is like kind of 3 months is sort of can you make something more consistent? I agree with that.
And are there any ways to boost your metabolism naturally to maybe help lose weight?
Mm-hmm. The best way is to be active. And so kind of being a good walker, making sure that you're walking places. Weightlifting is another great way to boost your metabolism because you increase the ratio of the muscle in your body. And so your muscles do actually help promote metabolism because they use up more energy than the rest of your body does. So just even, it doesn't mean you need to go like bench press, but start to put some dumbbells into your workout or, you do some kind of resistance training. And there's a lot of resources out there and it can be very overwhelming, especially for women to get into the weight room. But there's a lot of really nice resistance band training or the use of just like smaller free weights that I think sometimes women feel a lot more comfortable with.
Yeah, I get intimidated when I go to the gym and I see all the men lifting weights and whatnot, but you really can even just do it at home if you are intimidated. Is there anything else that you'd like to add about maintaining a healthy weight? Maybe like something motivational for women, maybe that would do want to lose weight and just to know it's not impossible.
Right. Well, it's not impossible. It does take a little bit more work, but also there's more of a focus now in healthcare. You'll kind of see some of those slogans and hopefully some of the physicians or provider offices have kind of started to adopt that in that, think about your health, think about what you want to accomplish and how you want to feel. Is it more like, hey, I just want to be able to go up the stairs and not feel short of breath? And, I think that's a fabulous goal. Looking at and focusing on a number sometimes can be really depressing, but if you actually feel really healthy and you haven't had to change pants sizes, chances are you're in a really good role or you're in a good mode. You're in a good situation. So a lot of it is, hey, let's just look at your health. If your cholesterol's still good, your blood pressure is still good, you're not you're not toying with diabetes, then I think, whatever weight you're at, you're actually a pretty good weight.
Let's talk about mental health, because that's another thing that has been talked about so much more. I feel like over the past few years, especially since the pandemic. How do you address mental health concerns that young women may face, like anxiety, depression, or body image, like we were just talking about?
Right. Yeah. Well, I mean, a lot of it is asking about it. I think that's the most important thing, is they may not come to you specifically with like a diagnosis of anxiety or like, oh, I think I'm really anxious. A lot of it will come to us as sleep issues, focusing issues. ADHD is like a huge kind of buzz topic these days, and kind of trying to suss that out with the patient is like, are you having trouble focusing because you've just got a lot to do? Or are you having trouble focusing because you actually truly have a diagnosis of ADHD? Those complaints kind of open up the door for, hey, let's maybe explore, what's going on. The other complaints that I will often see is like any kind of chronic pain. Abdominal pain's a really big one. Of course, we always evaluate it and say, hey, let's make sure there's not something, call it metabolic or organic, going on. But when we've actually like done all of the basic labs and everything's coming back normal, that's when we kind of address, hey, what's going on in your life? Could there possibly be related to stress? So I think the biggest thing is actually, asking about it, because some patients won't actually ask about it. It's really wonderful when someone does come into you and say, I'm really anxious. My family's noticed this and I want to seek help. And it's fabulous because you're like, okay, that's the first part, is acknowledging it. And, a lot of that is actually very amenable to talk therapy, to some form of counseling. And the good news is that, there's a lot of virtual counseling now. There's in-person counseling. If you're lucky enough to work at a place that offers like employee assistance, you can actually get some of that for free, just getting them in and getting them the resources they need.
So you touched on this a little bit, but what are some of the signs and symptoms that you haven't mentioned yet about mental health conditions that young women might experience?
Oh, sure. Yeah. Probably sleeping issues, chronic pain, or like a physical condition that you have had worked up and they cannot actually find a cause for. That's a big kind of a red flag to us providers. But sleeping issues is one of the biggest ones. Focusing issues. There's a group of, I think it's 7 or 9. It's 9, I believe, of appetite issues, being able to focus, being able to get a task completed. When some people notice, I've been trying to do, taxes is not a good example because nobody likes to.
No, we don't
taxes.
Like to do those.
But, like you have a task or a deadline to come up with and you just really, it's so hard to motivate yourself, like not wanting to get out of bed, like really having to motivate yourself to get out of bed, not enjoying the things that you used to enjoy. Friends may have noticed, hey, why don't you come out to the movies with us? And you're just like, I don't know, it just doesn't feel good to me anymore. Or I've had a few introverted patients that say, I can't read this book. And I used to love reading. I remember one patient in particular, that's how she kind of knew something was up, is that her mood was bad because she wasn't enjoying the things that she used to enjoy.
So a question I have going off of that, so like sleep issues, right? Or maybe being able to get out of bed. How do you differentiate when, okay, it might be like a mental health concern, or like, I just know sometimes in the winter when I'm like warm, yeah. I don't want to get out of bed. Right. So how do you differentiate where it actually might be an issue, or it could be just a situational?
Situational, yeah. Well, no, that's a really good question. A lot of it has to do with timing. Situational is, this has really only been going on for the last, few days, or, I was on vacation and now I'm back and I'm having a hard time motivating myself. Or anytime there's a change, we call that an adjustment disorder, and so that's actually very situational and actually very normal, very healthy, for how your body kind of processes things and responds. 2 weeks is actually our cutoff, is like sort of when things go longer for the 2 weeks that we sort of say, okay, let's look at this further. And there doesn't seem to be a trigger. There's not a trigger like a winter morning or something at work that you really don't want to go and do. Sometimes that's kind of a natural response. But if you're just like, no, I actually have some really good things going on at work and I still am not motivated to go and do things, and it's been going on for 2 weeks or more. It's actually not a very long time frame, but that is the time frame that we use for mental health.
The other week, I think it was, I was having such a hard time sleeping for like the entire week. I couldn't figure out what it was. I didn't think it was stress or anything. And then I just started to just be like more strict with my routine. And then, I was able to sleep through the night again. So I like the 2-week rule. Don't like panic or, freak yourself out until it's been 2 weeks. Do you have any tips for managing stress for women? Like, I know I always am juggling a zillion responsibilities. Do you have any tips that maybe I could incorporate into my life?
Oh, yes. Yeah. Well, I know if we had the secret to stress, like I think all physicians would be out of a job. So
that's true.
A lot of it is, surrounding yourself with support, and, whether that's support from loved ones or support from colleagues or just support from yourself. A lot of the stress management is about, make sure you have time to exercise, make sure you're eating healthy. And that is actually very, very important to always, try and eat healthy and not eat a lot of junk food. We do tend to stress eat.
I do all the time.
I know. Anytime we're on call, we're like, I am getting that burger and fries. And it's like, oh, maybe I shouldn't do that. So keeping up kind of those healthy things is very, very important. And finding out what helps you relieve stress that's healthy. Healthy outlets for stress like include anything from being extroverted to being like joining a running group or going to a fitness class or a book club, or something as introverted as journaling, or like some people are really arts and crafty. So a lot of those are extra activities. Though I recently watched a seminar on, a lot of stress management is about like all these things that you also have to make time for. And that's not always very fair. There's now a lot of our behavioral health colleagues are really focusing on self-care. So what would you tell a friend going through a hard time? And kind of telling yourself those exact same things, that it's like, hey, this is very stressful, but you are going to get through it and you have the skills to get through it. It's a hard mentality to have. And I don't believe I actually have that myself yet, but it'd be something I'd like to strive for. I mean, so obviously like healthy living and having really healthy outlets for stress relief are very important, but kind of trying to learn how to have that self-compassion. But a lot of times you need some help, with kind of figuring that out, whether that's through a self-help book or through a counselor.
So the last question I want to ask you about mental health concerns is about hormonal changes, like when, you're on birth control or you have your period. Do those things actually affect your mental health, or is that just a myth?
That's not a myth. Yeah. I mean, there's not a lot of scientific evidence to say, oh, yes, these birth controls make depression worse. But like, if people have the symptom and, people tell me, hey, consistently, whenever I'm on my menstrual cycle, I'm very irritable. I believe them. It's like, yep, there probably is some correlation to it. And, so it's not just a myth. Like people can have very profound mental health changes around hormones. And so sometimes if people say, you know what, like my symptoms started when I started this birth control pill, it's like, okay, let's look at other options. Or some people say, well, I really, really want to be on the pill, but maybe I need to look at something else. And then there are some things that you can do around menstrual cycles, whether it's exercising more, there are medications that can be used, using hormones to manipulate the cycle so that you don't have them as often is also a very good option.
And I think too, just when like you do have that time, you just feel not great. So maybe you're just a little crabbier. So maybe that's not science, but I'll say it's science from me.
You can say it's science.
From my point of view.
If you're feeling it, it's real.
Yeah.
It's like, yes, it is a diagnosable condition. And yeah, it's like, I'm not going to dismiss that at all.
Yeah, definitely. But yeah, take your word for it, not mine, but just from personal experience. We did get a question now, shifting gears a little bit to, for all women and maybe women from diverse backgrounds, or those that belong to maybe like marginalized communities, how do you address their needs and concerns?
Yeah. And that is a very, very important question. It's a very challenging one for myself to answer, not being from a, minority group. I think a lot of it is listening to them and reaching out. Fortunately, healthcare is doing a better job of saying, hey, we need to listen to these stakeholders and actually learn what they need from us. I know our clinic helps a lot of people with opioid addiction. And so they are very marginalized. And so, what we have done is, we really make ourselves accessible to them, and try to break down a lot of those barriers so that they actually can get into our clinic and don't feel judged. The other thing that's really important is getting more providers who are in a minority group. And so, that's a really long-term solution, but they have kind of shown that when someone has a provider that looks like them or comes from the kind of the same background as them, they actually receive better healthcare because they trust that provider a lot more. And that totally makes sense. And I really respect that.
Yeah, absolutely. So now we need to shift gears and talk about sex and sex drive. We got a lot of questions about this topic because I feel like people are embarrassed, to talk to their doctor about it maybe, or maybe they're embarrassed to talk to anybody else in their life about it. But one of the questions we got says, my sex drive has been low lately. Is this normal? Is this common? And what factors can affect a woman's sex drive?
Yes, that is a fabulous question. And it is one that I think a lot of people are embarrassed to ask, but it's actually incredibly common. I think if you probably surveyed all of the women that came through your office, someone would say, many of them, I think a majority of them would say, hey, yeah, I've experienced some problems with sex drive or, sexual dysfunction. And they are afraid to bring it up because they feel like it's just them. It is not an easy answer. So yes, it's normal from the standpoint of yes, this is very common. B, the problem is it's very multifaceted. It has to do with situations, so a lot of it has to do with stress, which we talked about, just feeling overwhelmed, feeling like you have multiple people wanting your time, feeling like I don't deserve to have this, or if I don't get all my work done, I can't enjoy things, so a lot of it has to do with stress. A lot of it has to do with, relationships change over time. What are your, sexual partners like? Are they people that you have good relationships with, or are they people that you're kind of about, so sometimes it has to do with that. And then sometimes there's a lot of medical things going on, so we do have to look at, hey, are there medications that could be affecting this? THC use, overusing alcohol, so substances actually really do play a role in kind of decreasing that sex drive, so I would have to do a really thorough history and physical, probably a very good history on a patient who came in to me and said that. But, it's let's try and figure this out together. What is the cause of the low sex drive?
And like you said, a lot of it can be situational if you're stressed. So when does it cross that line from, okay, I don't need to be worried because I'm just stressed out right now, to maybe there's something going on?
Yeah. A lot of it is if you've actually already tried all of the techniques for helping sex drive are not medication based. We start with couples therapy or sometimes individual therapy, starting with exercise, to help your self-esteem. Some of it may be a body image issue and just helping you feel better about yourself. And so finding ways to do that. So sometimes that's individual counseling or, couples therapy. And then some couples therapists are registered sex therapists, but if they aren't, they can often help refer you to someone who is, so sometimes looking into someone like that. So if you've done all of that, and you've done all of that for several months, and then we are still seeing, some issues, and you've already done a washout of potential medications that could be contributing to it, then it would be time to say, okay, yeah, something else is going on. But a lot of times the sex drive issue will go away when we start with some of those behavioral issues.
And you kind of touched on this, but are there any lifestyle changes or habits that can boost a woman's sex drive?
A lot of it is anything that makes her feel good about herself, so yeah, exercise can help tremendously. Eating healthy can help tremendously. I think if you're not eating healthy, oftentimes you don't feel well physically, and so then that really does affect your ability to feel like, oh, I'm a desirable person.
Does sleep play into that at all? Because I feel like, I hear new moms say, oh, my sex drive is low because I'm just so tired. Is that normal in the everyday?
Oh, yes, that's incredibly normal. I can't tell you how many moms have said, it's I'm not against sex. I'm just really tired and I would rather sleep. So when they go to bed or when they finally get a chance, a free moment with their partner, I'm only getting 6 hours or less of sleep, so they kind of look at that as their time is very limited. So no, that's very normal. And so, yeah, you have to kind of investigate ways to how do we make our sleeping a little bit better, for sure.
Right. So speaking of pregnancy, what role do hormonal changes play in affecting sex drive, like when you have your period or you're pregnant, or maybe even if you're going through menopause?
There isn't one size fits all when you are pregnant. It depends. You might have a very challenging pregnancy in terms of nausea, vomiting. So some people just feel sicker during their pregnancy. So that can definitely affect your sex drive. Some people have very healthy pregnancies in terms of they feel great. And so the sex drive may actually be boosted during pregnancy. For sure, anytime after delivery, like that postpartum period, your hormones plummet. I mean, you go from a time in your body when you have tons of hormones, and then as soon as that baby and placenta are delivered, your hormones just go they just completely drain. And that's when we see a lot of mood issues or, depression issues. But then that also can happen whoa, where did my sex drive go? And then you throw in a new baby to it. So yeah, for sure, pregnancy affects sex drive. And then aging and menopause, that's actually a really common thing. That one tends to be a little bit more medical because you get some drying and atrophy or thinning around the vaginal area. And so sex can actually be more painful. And so if you think about if an experience is painful and physically unpleasant, then how likely are you to want to keep doing that? And so this is where, you'll have a postmenopausal woman come in and, she's afraid to say something, but then she's saying, well, I'm having this issue with my partner. And so then you can kind of investigate that together. So yeah, that definitely can affect your sex drive just because of a medical issue or just, kind of the physiologic changes that your body goes through, as your hormones are decreasing.
Another somewhat taboo topic I want to ask about is STIs. Can you talk a little bit about that and just safe sexual practices in general?
Mm-hmm. We're seeing a resurgence of syphilis these days. So that's not as common still, thank goodness, but that is one to think about. That's actually, we test that with a blood test. The reason why I kind of started with that one is because most of the tests that we do are either a urine test or a vaginal swab. Gonorrhea and chlamydia are probably two of the most common, or at least the most well-known ones, along with trichomonas is the other one that we see a lot of. And they can actually be rather asymptomatic. So a lot of people don't realize they have them. And so actually it is recommended, the Preventative Task Force do recommend that anyone who is sexually active with a partner under the age of 25, we actually screen for gonorrhea and chlamydia. Usually, while we're performing that testing, we also test for trichomonas just because we're in the area. And then we will also offer HIV and syphilis testing as well. And those are two blood tests that are, most patients are actually very agreeable to it because it is, it's recommended. So yeah, it's important, knowing your partner. And some people have multiple sexual partners. And so, how do you stay safe with that? I mean, the biggest way to stay safe with that is with the barrier methods, with condoms for the male partner. And so that's really your best protection against those STIs, because even if they don't have symptoms, they can actually have repercussions down the road when you want to get pregnant. You can have scarring in your fallopian tubes. And so then you are less likely to be able to get pregnant. Or, some people do develop really awful pelvic infections that can be quite painful. And actually, I've seen people be hospitalized for those before, but they didn't have symptoms at the beginning. And so that's why it's important to be tested, before you get a new sexual partner, and definitely be tested, anytime you change sexual partners. We consider kind of high-risk sexual behavior to be, you either are exchanging something for sex or, multiple sexual partners and then not using any kind of barrier are kind of high-risk sexual behaviors.
Yeah. And I feel like that's another thing, if you're under 25, I can't speak for those women, but I feel like that'd be another thing that maybe they would be embarrassed to talk about.
And that's where it's helpful. I sometimes wonder if we kind of assume too much. We're like, oh, would you like to have, STI testing done? And, someone who isn't sexually active at the time kind of looks at you with this wait, what? But, we just try and make it very non-judgmental in terms of hey, while you're here, this is something that's recommended for someone under the age of 25. Is this something you would like? Kind of just being more hey, this is something that we offer you.
Mm-hmm. Mm-hmm. Yeah, definitely. What are some other frequent topics that are brought up from women to you that maybe women struggle with that I didn't ask you about?
Oh, yeah. You touched upon the biggest ones, which was weight loss. Mm-hmm. Fatigue is another one that we hear a lot. Yeah. And if you talk to a bunch of different female providers and you say, all right, what are your most common topics when someone comes into you, when a woman comes in for her wellness exam, and we could probably all rattle it off. It's yep, weight gain, fatigue, stress, those are kind of the three that they bring up a lot. Fatigue is a big one. And again, it's it's not an easy answer. Some people say, well, I know why I'm tired. When I first was dating my husband, I was tired all the time, but I was a resident and I was on call every third night. And he's like, well, why are you so tired? Shouldn't you see someone? And I was like, no, I know why I'm so
He's
tired.
never watched Grey's Anatomy, clearly.
Right.
Yeah.
I know. I was like, no, I'm the person I would see about my fatigue. And I also know why it's happening. So a lot of times women can actually pinpoint, you're like, oh, you're taking on this extra project with, your kid's orchestra, or, you've suddenly, become the soccer coach for your kid's soccer team, and that can be very stressful. Fatigue is a big one. And, that's where we do have to say, well, is this a thyroid issue? Is this diabetes? There are things that we kind of tend to rule out. Is this anemia? Low blood count can really cause it. But I think a lot of it is just women feel really pulled in multiple directions. Oftentimes, again, not telling themselves they deserve that compassion and that they deserve that downtime that they are looking for.
Because women balance so many things in their lives, when does, being tired kind of cross a threshold? Because you mentioned diabetes, you mentioned maybe a thyroid issue. When should we actually be concerned about how tired we are?
Yeah. Really something like you are sleeping for 12 hours a day and you're still not feeling really good. First of all, 12 hours a day is probably too much. You notice you're napping a lot and you're still needing, some help or just struggling to get through the day, then it is time to like, hey, let's go to the doctor or the clinic and look at things. The other thing I forgot to mention, sleep apnea is a big one that can cause you to feel really fatigued. And then also if just things have changed, like your hair has changed, you're noticing your hair is a lot drier or it's falling out more, or your bowel habits have changed. You used to be very regular and now you're having a bowel movement once a week. Those are kind of signs that it's like, oh, there's something else going on. Other physical symptoms, shortness of breath, so can kind of key us in that there's maybe a medical condition going on.
So if you do feel like any of those things you mentioned, because again, like talking about bowel habits, I just did a podcast episode on it and I was actually excited because I'm like, women don't talk about this.
No,
Definitely consult your doctor. So I guess my last question for you would be, how can people advocate for themselves? Because I have family members that, they felt like something was wrong and they really took it upon themselves to get to the bottom of it. So how can somebody be a good patient and advocate for themselves?
Right. Yeah. Well, first is being kind of recognize those signs, making an appointment. Ideally, you have a relationship with a provider that you trust and you have a good relationship with. If you don't, oftentimes finding, good recommendations from coworkers or friends or neighbors, finding out who they really like, that's important. But when you do show up at the clinic, waiting for that appointment is trying to be as organized as you can. And that's hard when you are feeling like really overwhelmed by some medical things or just by symptoms that you have and you're feeling very anxious about it. Being organized, kind of knowing, hey, when did these symptoms start? Were there any, was there a time frame or were there any events that really kind of triggered it? What have you tried? And a lot of times it may mean that you have to write things down. That can be helpful to, kind of journal a little bit, but having, kind of at least a little outline so that you are presenting a pretty concise picture of like, hey, this is what's going on. Knowing your medications and knowing your medical conditions is also incredibly helpful. It shows that it's like, okay, yep, you are really concerned about your health. And then also it just helps the doctor kind of know, all right, this is what you're on and kind of know if there's anything interfering there. So that's the best way to really kind of to present yourself in a very organized fashion. And also, if there's a question that you want answered, or I am worried that I have cancer, or I am worried that I have a thyroid condition. Actually saying that is okay to say. And a provider should listen to that and say, okay, here's the reasons why I am also worried about it. Or, oh, here's the reasons why I'm not worried about it. And, then they should be able to back themselves up. If you aren't actually saying that, like what you are most worried about, we aren't going to know that this is what's in your, what you're thinking about. And, I really try and train my physicians that I work with. It's like, hey, let's always try and figure out the underlying reason for someone coming, but we are, we're busy and you're busy. And, sometimes the visits are, feeling a little rushed. So the sooner you can kind of get that agenda out, that's very helpful. Our providers are trained to try and seek that out from you. But if you can provide it, it's even better. And so that's really how you advocate for yourself. And then also trusting your provider. They should come at you with, with a medical response, with a scientific response, and trusting assuming they have your best interests at heart. And if you don't feel like that is the case, then you are more than welcome to get a second opinion. But a lot of it is, these providers are coming at you with expertise and with knowledge because they've had experience dealing with patients. And so really trusting what they have to say and seeking that guidance is also really important.
I feel like I've talked your ear off for an hour now about all these questions.
Yeah.
Well, I think that is a wrap on this episode of the Real Talk on Women's Health podcast with Essentia Health. Dr. Lauren Jamar, thank you so much. I loved tackling all of these frequently asked questions, and just thank you so much for your expertise.
Yeah, thanks for having me.